Our mission is we improve health every day. We recognize as a system that one of the things that we needed to do was to take a critical look at how we manage diabetic patients. One of the key factors related to great management of diabetic patients is to how do you manage their blood glucose levels and keep it on an even keel wherein patients are not having a blood glucose level of 90 this morning, 180 this afternoon, 200 by tonight, and we found that by utilizing the glucomander system, we had the ability to keep the blood glucose levels very even within the national range. Patients were recovering better. We were achieving great outcomes with our SCIP measures, and ultimately what we saw was a reduction in our length of stay days because these diabetic patients were getting out of the door faster. We looked at our cardiac population of patients, and on post-op day 2, we struggled. We struggled with managing their blood glucose levels below 200. And one of the things that we noticed is that while we had a paper process within our electronic medical record system to manage these patients, it was truly dependent on the role of the nurse to, number one, be timely in checking the blood glucose levels of these patients, and then responding to a treatment plan for that patient. And it varied, and as you know, with humans, everyone has a different time schedule, and it became very difficult in us maintaining our consistency. We collaborated with Glytec, we brought in the glucomander, and what we saw immediately was a significant improvement in our ability to keep our patients within the defined parameters for glucose management. And I will be honest, we had quite a few fallouts over the past year, and when we enrolled our patients and collaborated with Glytec, we saw 100% return in terms of no patients had any fallouts. We were better able to manage their glucose. Having worked at Virginia Beach General Hospital for several years, I had an opportunity to see glucomander in use for over 10 years. And what we saw with the cardiothoracic population of patients is immediately post-operative when they went into the CSICU, we started them immediately on glucomander. And we achieved a 100% results in terms of meeting our SCIP measures. We did not have patients who fell out. We also were able to implement glucomander on our step-down units, 2 West Wing and CCU, and in both of those areas as well, patients were managed extremely well utilizing glucomander. So having had that history and having looked at the wonderful outcomes that Sentara Virginia Beach General Hospital achieved transferring here to the Heart Hospital and to the Norfolk General campus, I knew that I had an opportunity to share the data with the team and to encourage everyone to come on board and to utilize what I considered one of the best practices that we have within the system. Technology has taken a new place in delivering great quality outcomes for patients. We here at Sentara believe that everything that we do must be evidence-based. It must be based on great quality outcomes. And so to those individuals who are hesitant about, removing their fingers from that, I'm going to stop this insulin drip and I'm going to wait and see, I would like to encourage them to look at the data, look at the evidence. The data and the evidence shows that when you utilize glucomander to manage your patients, you get better quality outcomes, the patients recover faster, they heal faster, and overall they do extremely well. Ultimately, what we want is what is best for our patients. Ultimately, what we want is to move to a management module for our patients. And what better way to manage your patients than to rely on technology that aids you and assists you in providing great quality care for your patient.